What are your targets for general practice?
Oh, immunisation. That's the primary care target. And if we look at that, that's a really ambitious target. So 95% at year 2, that's primary care.
Sure, but it's not the only reason that people go to the GP, right?
No, but you can't have too many targets. You get target fatigue. So that is the one I need primary care to do well. And part of the question's been raised, is it ambitious enough? We have never, ever reached 95%. How much more ambitious could you be than never having reached it?
Sure, but I mean, I'm not disputing the merit in having a target around immunisation for kids' immunisations. I'm sure a lot of people can see that there's a lot of merit in that idea, but GPs do all sorts of things, don't they? And for most New Zealanders, it is the part of the health system, the primary care system is the part of the health system that Kiwis use the most. So why wouldn't you have broader targets for GPs?
So these are the top line targets, the 5 targets. Underneath that are a range of other less reported but still measured and watched. So for example, PHOs have targets around what's called SIMS, system level measures. So there'll still be other targets, for example, around ASH rates, keeping children out of hospital. That's a primary care target. It's just not one of the 5 priority targets that I've identified.
What about a target for Kiwis just seeing their GP, if they want to see their GP?
So this may well be a target that we bring up as well for primary care. It's going to need a lot of discussion and a lot of work with primary care, particularly around workforce, before we set a target. You know, it needs to be achievable
so it's too
as
hard
well as ambitious.
at the moment.
It's certainly challenging.
But isn't that the purpose of a target? So that means that the targets you've introduced are all easy?
Oh no, as I said, very ambitious. We'll struggle to get to the immunisation.
But you don't have a broad target for the part of the health system that Kiwis actually interact with the most.
Underneath that, PHOs have targets. That's part of their agreements, and they're primarily, if not solely, primary care targets.
So according to Health New Zealand, I'm putting you on the spot here. Do you know how many New Zealanders couldn't get an appointment with their GP last year?
Oh, I wouldn't have that finger.
It's about 500,000 adults, 73,000 children. So why not structure a target around those numbers?
Look, I don't disagree, but there's also going to be a discussion with primary care as to what they think is a reasonable target. So those discussions are still to be had, particularly in the context we have at the moment with constrained workforce. So it's not a discussion it's not a target that I would take out myself without deep discussion with primary care as to what do you think it should be, what is achievable, and what might the milestones be to get there.
So why haven't you had that deep discussion yet? Obviously, our primary workforce is under huge strain at the moment. Why haven't you had those conversations?
It is because what primary care is telling us is stabilising the primary care environment is actually their first concern. And what that means is it's workforce, it's remuneration, it's retention. They're saying to me, stabilise the workforce,